Myself Mr Kannan, Department of CC, Savita School of Engineering, SciMaths. Today we discuss about direct method of BP measurement. The direct method is criterion standard and consists of using an intra-axial catheter of obtain a measurement. The indirect method involves the artery with an external cuff, providing an inexpensive and easily reproducible way to measure blood pressure. Definition of blood pressure, including the difference between systolic and diastolic pressure. Definition of Cancroft sound and an oscillation graph. Choose an approximate size blood pressure curve. Demonstration of the technical and manual measuring of patient's blood pressure and corresponding functions. Next one, what is blood pressure? Blood pressure is the pressure extended by circulating blood on walls and capillaries. So what are the 5 vital signs? Blood pressure, temperature, heart rate, oxygen saturation and respiratory rate. And next one, what are the information we gathering from your blood pressure? So as factoring in determine blood pressure, heart rate, vascular tone, blood volume, blood viscosity, arterial compliance, myographical continuously. In this case, we have the normal ECG signals. In this case, first one, the actually compared to your systolic and diastolic signals, diastolic signal is compared to yours very low, and in this case between signals only we are gathering your blood pressure. In this case, we discuss about rhythmic noises heard in an ordinary that is being partially compressed by a blood pressure curve. It occurs when such as compressive pressure is between the person's systolic and diastolic pressure. So in this case, we discuss about in the curve between your arms. Okay. In this case, how is the blood circulation flowing and what will happen between that? We will discuss how to measure the kind of sounds in this meter. What do you mean by arterial gap? An arterial gap is present when there is a range of blood pressure in between the systolic and diastolic in which there are kind of sound. The failure to recognize an arterial gap and can be result in an underestimation of the systolic pressure and or an observation of the diastolic pressure. The timing of the BP measurement. Blood pressure varies through the day. Blood pressure can be temporarily affected by the excesses of kind of the consumption of within period of 30 minutes. For patients taking an hypertensive medication, it is preferable to measure the blood pressure immediately before the meds are usually take tough to this offer of the not practical. So what are the procedure you want to follow? Properly position of the patients, back supported, both feet flat on the floor, arm supported at the level of heart. Select the proper size of cuff and the length of the cuff. Bladder should be at least 80% of arm circumference. So work the cuff around the arm such that the bottom edge is 2 to 3 cm above the creases of the elbow. Visible movement of the carriage middle should not be used as a storage of the blood pressure. Thank you.